ครับสวัสดีครับ
Sadika, were you surprised by the sudden surge of new cases in Samut Sakhon?
Actually, we predict that this kind of situation may occur since we knew that the situation in Myanmar was very bad for a few months already, and we had Thai returning from Plipat to Thailand also got COVID-19 just a few weeks ago. We predict that there could be a situation where people from Myanmar um, may contact the disease and then arrive illegally to Thailand. And we also predict that these kind of things could have happened. So actually we did added several measures in order for us to detect the event. But unfortunately, the event went undetected for a few weeks, and then that is why we have seen the numbers of patients quite a lot during these days.
Dr. Tanarak, the big question that keeps people on edge is that will there be a second wave, or do you call this a second wave because the number is actually very alarming?
Actually, if you remember, when we have the first phase or the first wave you call of COVID-19 in Thailand, the days that we reported the highest number of cases was just only 188 cases.
Right.
In March somewhere. And the total numbers of the first wave altogether was just roughly about 2,000 something. And later on, after we identified the last case of the first phase or the first wave of epidemics that was on May 25th. That was the day that we identified the last locally transmitted diseases for the first phase of the epidemics. So we are having an epidemic in Samut Sakhon, that's for sure. The numbers that we report yesterday was the highest ever in the country, with more than 500 cases. And today we reported in the morning, CCSA, 300 more.
Yes.
So altogether, you can sum up now, just for a few days, we now have about 900 cases overall. So we are facing the epidemics, or if you would like to say, call it the second wave or phase 2 or whatever. But for sure, we are now in the situation of having the new epidemics in the country.
And many people are starting to wonder whether it is necessary to impose another nationwide lockdown like we did before.
At the moment, we have several. We identified several cases that were out of Samut Sakhon. We have several cases in Bangkok, Saraburi, Ayutthaya, and several other provinces as well. Most of these people are the person who visit the fresh market or fresh seafood market in Samut Sakhon. So at the moment, we have two situations. Situation number one is trying to contain the epidemics in Samut Sakhon, and secondly, we have to identify the person who visits seafood market in Samut Sakhon. If they have any symptoms or got infected. And we have to fight both ends as best as we can. If let's say, if we can identify most of the cases that infected from Samut Sakhon very early, then I don't think that the lockdown will be needed. But if we cannot identify the one who got the diseases out of Samut Sakhon, and then they spread the disease within the localities then that will be another issue. So at the moment, I still would like to say that we still have concentrated or localized epidemic within just Samut Sakhon, and Samut Sakhon just export the cases to other provinces. Hopefully, we can contain the disease in other provinces. And
that's
then
why we
if
see.
that is the
That's why we see the razor
we may
wires.
not need to.
Sorry, is that why we see the razor wires around the market, just to make sure that they don't come out or nobody actually sneaking in to send them anything?
Let's put it this way. Currently, if we identify any cases from any apartment that the workers usually stay in certain apartments,
Right.
if we identify any apartment that could that has the epidemics, we then will set up that apartment or few hospital at that apartment.
Okay.
And one is to contain the virus to stay within that apartment. And the second objective would be that we would like to take care of all the patients at that apartment. If they don't have any symptoms, then they can stay in their apartment. Now, if you look at the numbers, this outbreak that has go undetected for quite a while, one of the main reasons was that we have more than 80% of infected individuals that doesn't have any symptoms, or we can say that more than 80% were asymptomatic. So we are now setting up the field hospital in the apartment. We would like to separate the one who already infected and the one who did not infected. For the one that is already infected, we are going to take care of them very well. And the one who did not got infection yet, we are trying to prevent them from getting. The best way that we can do in preventing anybody else who did not stay in that apartment to get infection from them is to don't let anybody in and out of those apartments.
So apart from the migrant workers, are there any other groups of people that we need to be concerned about at this time?
Yes, of course, because in the fresh market, it's not only illegal migrant workers from Myanmar who work there, and some of the workers are not illegals. They have work permit. So let's say that the workers from Myanmar in fresh market, they contact with a lot of Thai people, a lot of Thai who went to the market, the owner of the market, and several other drivers and somebody else who has been in contact with the fresh market, fresh seafood market. So currently, that is why we try to advertise that anybody who have been visited the fresh market in Samut Sakhon since December,
Yes.
since early December, if they have any symptoms, they should identify themselves
So
to healthcare personnel in order for them to be tested and taken care of.
So go back to the story of the illegal immigrants. There's a lot of people that actually concerned at how we treat them, how they sleep, how they eat, how we provide care for them. I understand that we set up the field hospital, but because there isn't that much image we see from inside that razor wires, can you tell us anything about their conditions of living?
It has been very crowded. So a lot of people packed into one room, and so their living condition is quite crowded. And what we are trying to do, as I mentioned earlier, is we try to separate the one who got infected and the one who did not. And then currently, since we don't allow them to come out of the apartment, the government will supply anything that they needed during this period, food, whatever that they currently need. And we knew that there are a lot of young children as well, so milk and other important items for women and children will also be provided to anybody who has to be isolated and quarantined in the field hospital or in the apartment.
You said several weeks ago that definitely will be a second wave. Is this a scenario that you think is going to happen, or you think it will be from something else?
Sorry, I'm not.
It was in the news.
The question is.
It was in the news several weeks ago that you said that the second wave definitely is going to happen. So I'm wondering, is this a scenario you think it will happen, or there's actually other kind of factors that you think is more worrisome?
I would like to say that the situation that we face is a lot more serious than we anticipated in the first place. When I said that we may face the second wave, I hope that we would be able to detect the epidemic earlier than this.
Okay.
This is something that has been went for so long undetected that we now have a lot of patients, a lot of infected persons. So to be correct or to make everybody understand the situation very well, I would like to say that we are facing quite a challenging situation in Samut Sakhon at the moment. But I would like to say also that everybody, not just public health sectors, but also the government, anybody, the governors, any sectors that working in Samut Sakhon, and as you see, even the private sectors join hand in hand trying to solve the situation. And I think this is, since this is a very tough and very challenging situation, I think this is the time that everybody kind of join hand trying to fight this epidemic together. This is not the time that we are pointing the finger to one another. You can point the fingers when the outbreak cease or when the situation getting better, but this is not a good time to do so. Instead, I would like to request anybody who's trying to comment or trying to critique whatever happened and trying to blame someone else, just to come in and join hand in hand to try to fight this epidemic instead. And I hope that everybody in Samut Sakhon and elsewhere understand that and being kind to the person or to everyone who is now currently fighting the epidemic
There is
in Samut Sakhon and also elsewhere.
Okay, there is an information floating around that the virus that is spreading in Samut Sakhon right now is a new strand. It's easier to spread and it's mostly asymptomatic. What is the fact about this? Do we know yet? Is it a new strand or what we faced before or anything different?
If the hypothesis is that this virus spreading from Myanmar, and we knew that the Myanmar virus was the new one, the one that we did not face during the first epidemic. Most of the virus that spread in the first phase, our first wave, was the different one. But I would like to say that currently, with the knowledge, whatever we have now, there is no evidence that this kind of virus are more spreadable. And there is also no evidence that this virus is more severe. So we knew that it's the new virus or it's new strain of virus, but it doesn't mean that it will spread more easily or it would be more severe.
Okay.
No.
Okay.
So what would be your advice to the government officials in terms of containing the spread of the virus and control the whole situation?
Actually, we work closely together. Our teams lead by our DG and our permanent secretaries is working closely with the governors and with the highest level of the government, that is the Prime Minister. There are several things that we are currently trying to do. First, we trying to detect the cases that already been infected. We try to identify the high-risk areas, and we will try to contain the disease at its source. This is our high priority. So the fight within the Samut Sakhon area is just that. Doing a lot of testing, doing a lot of investigation, and then trace anybody who comes into contact with the infected person, and then try to quarantine them, try to keep the disease at bay.
So can we call this?
We are continue to do a lot of testing.
Okay.
We try to do a lot of testing, and now I would like to also mention that so with these strategies, and I have already mentioned that the epidemics or the disease may spread within Samut Sakhon for quite a while. So in the next few days, up to probably 5 to 7 days, we will continue to see high numbers of infected persons. Yesterday we have 500, today we have less, about 300. Tomorrow's may be quite the same number that you saw today. But hopefully, if the situation is getting better, we hope to see the declining numbers after day 3, day 5, or day 7. That's really depending on how much the disease already spread to within the Samut Sakhon. If we can control the disease, then we will start to see the declining numbers in the next few days, but not now.
So can we call this second wave yet?
Yes.
Okay.
I think I already answered that question.
Okay.
But you have to understand this. Currently, it is an epidemic or an outbreak within Samut Sakhon province. If you ask if it's the second wave of Thailand yet or not, that will be quite a challenging question to answer. If you ask if this is an epidemic in northeastern regions, no, I would say no, because there has never been any cases in northeastern region yet.
Right.
So at the moment, the epidemic of COVID-19 in Thailand is localized and just concentrated within just one single province, that is Samut Sakhon.